歡迎各位出席今日嘅簡。
Good afternoon, ladies and gentlemen. Present today, we have Dr. Chuang Shuk Kwan, Head Communicable Disease Branch of the Center of Health Protection, and also Dr. Sarah Ho of the HA. Dr. Zhang will give us the latest update, first of all. Last night, we confirmed 13 cases. They are cases 11352 to 11364, 3 of which are imported cases. They are respectively arrivals from, well, 2 are from the Philippines and 2 are from Indonesia and 1 from the Philippines. One of the arrival from Indonesia had her sample taken on the 12th day. For the Filipino case, she arrived via PR330 on the 17th of March and was confirmed positive at the airport, and she is a carrier of the M501Y variant. Together with this case, we have a total of 96 variant strains, 17 of which are of the UK strain, 8 the South African strain, and 46 strains which have not yet been classified. We have another 10 local cases, of which 6 are linked to earlier cases. All of them are confirmed at quarantine centers, including 3 cases which are linked to the URSS cases, 2 of which are close contacts and 1 is a customer. Altogether, the URSS cluster now has a total of 138 cases. We have 3 other cases which are linked to other confirmed cases. 4 of the cases are untraceable, including the first one, a 23-year-old male who actually works at the Ecom Asia Limited, which is located on the 12th floor of the Home Plaza in Chatin. Her last day of work was the 11th of March. She lives in South Horizon, the Mei Ling Court. So one thing special of this case is that several of his family members, there are 4 of his family members who earlier in February already had the onset and have been confirmed. In February, he had actually been sent to the quarantine center and have been tested several times and found negative. She started to have a fever on the 17th of March, so this could be a case of new infection. Of course, we do not rule out the possibility that during the onset of his family members, he might already have been infected at the quarantine center, but we're not able to find that out. The first time the sample he submitted on the 17th of March, the CT value was rather high, around 30. When admitted to the hospital, we tried to find out whether there are any bodies. If so, then it will prove that he has been infected earlier. Otherwise, this would be a new infection case. The office he goes to work to and his residents will have both to be subject to compulsory testing. The second case involves a 62-year-old housewife who lives in the Ping Yan House of Ping Tin Estate in Lam Tin. She lives with her family members, and normally she would go to a restaurant called the Chiu Fuk House in the vicinity of where she lives at the Kai Tin shopping mall. She would be chat with the neighbors in the area. So this is a place which she frequented most, and we've also now asked this restaurant to go have a thorough cleansing, and people who have been in touch with her will have to be quarantined. We have another preliminary positive case who is one of the Kai Fongs who had contact with his housewife. We are investigating how close was the contact between the two. The place where she lives will now be subject to compulsory testing. The third case involved a 36-year-old male who lives on number 18 Westland Road, or rather he works at the CLSA Limited located on the number 18 of Western Road. He had been to Joint Dynamics to work out and was found to be preliminary positive. She lives in the Lohas Park, Almond Blossom, Block 9. We have, according to the record, on the 26th floor and the 61st floor of the building where he goes to work, there have been 2 other cases, both of which are patrons of Ursus. So this is the 3rd case we have found in the same building. The other 2 cases are related to the Ursus cluster. For this one, so far we have not been able to trace the origin. To be safe, we are recommending that the whole building should be subject to compulsory testing. The 4th case involved a 71-year-old male who lives in the Kalinwai village, where he is a chef of a restaurant there. But he does not have to actually to be in touch with the customers. He mainly works in the kitchen of the restaurant. He lives in the Block 6 of Training Garden in Chin Mun. This patient is asymptomatic. He took the test on the 15th of March, and the sample was found to be indeterminate. But eventually he was, found positive. But we also found antibodies in his body, so he could have been an asymptomatic case earlier. As for his place of work, all the other people who works there will also need to be, quarantined. And Block 6 of Training Garden will now be subject to compulsory testing. There is another building which has to be subject to compulsory testing, which is actually the Nova on 3rd Street in Sai Yin Pun. So I've already mentioned those 3 buildings which have to be subject to compulsory testing, and also the 2 work premises. Today we have 2 kindergartens where there is an outbreak of the upper respiratory tract. For these 2 kindergartens, they would need to be subject to compulsory testing, both the staff and the pupils. One of them is the Baptist kindergarten in Samshepo. The other one is the International English kindergarten in Kowloon Tong. Amongst the preliminary positive cases, several, fewer than 10, one of which is a carpenter, fitting out worker, who from the 11th to 15th of March had actually been working in the HSBC headquarters. He is responsible for the fitting out work on the 8th, the 11th floor, and there were fewer than 10 people working with him in the same premises. There were no other people working in the area because the area was being fitted out. Subsequently, he went to a shop on Staunton Road to work from the 11th to the 15th of March. He had not been to the other floors. So he was identified when we conducted testing for staff of the HSBC headquarters. He had no symptoms, and still he submitted a sample. Now he lives in Caroline House, and the people who work together with him in the fitting out work would need to be subject to compulsory testing. Well, typically he would go to Hong Kong style restaurants for meals, and also had meals with his colleagues. That's all for my report today. Dr. Ho? As of 9 a.m. this morning, during the last 24 hours, the HA system reported a total of 23 cases, we have 12 confirmed patients who have been recovered and been discharged. We have a total of 10,837 patients who have now been discharged. As of 9 a.m. tomorrow, we have 280 confirmed patients staying in 19 hospitals, public hospitals, and the Lantau facility. 10 of them are in critical conditions, 10 in serious condition, and 260 in stable conditions. Number of negative pressure wards, 1184, usage rate 59%. Negative pressure wards, 648, usage rate 68%. Also like to report to you inventory of PPEs. For surgical masks, we have 100 million pieces. Respirators, 8.1 million. Facial masks, 9 million. PPEs, 1.6 million. So PPE stock is sufficient. Will be sufficient for our use for 6 months.
商業電台
Commercial radio. Just now you mentioned a 62-year-old housewife who lives in Lambton, and she went to the Chiu Fuk cuisine always. So I'd like to ask you, can you tell us during the incubation period, how many times has she been to the restaurant? Usually at what times? Can you give us the details on the time when she went? And also the Department of Health, so far, how many people did they manage to track who had been to the same restaurant in the same time slots? And how many restaurant workers were involved? People who had conversations with her or workers who work in the same restaurant? And how the Department of Health would assess the situation? Could that be another potential repeat of the cluster or outbreak at Ming's restaurant at K11? Well, she fell unwell on March 9th and March 10th. She went to the restaurant, as far as I know. Earlier on, I think on the 7th or 8th, she had been to the restaurant. According to what she said, when she went to the restaurant, because she was with her grandson, a baby, so there were a number of restaurant workers or people at nearby tables would come forward to her to talk to her or even hold the baby. And so one of the potentially related case was identified. As for the others who had conversations with her, we were trying to track them down. She was during the infectious period then, so we are worried that there could have been some transmission going on. So we would try to locate the people who had contacts with her and recommend that the restaurant should be closed for cleaning and also to have testing. And I think the case concerned have installed Leave Home Safe app. So we know that she was there around 5 or 6 in the evening. For the other notifications, people receiving notifications, they are recommended to go for testing as well, because we can't work out how many people had been there during that period. So far, we don't see that there's no outbreak yet, and we only identify a case who had been in contact with her, so we haven't seen any outbreak there yet. Sorry, March 10th. I can't remember exactly. I think she was there, however, for the dinner. Can't remember the exact time. At the back, please. This one. Cable TV. For the untraceable cases, the 71-year-old kitchen worker, when was his last time of being tested? What was the date? How many times of testing had he undergone? And also, we also heard the news that the government is going to tighten the testing or quarantine arrangements for people arriving at the airport. And people now exempted would be required to wait at the airport until they have received negative results of their test. So what are the exception categories? Is it that everyone arriving at the airport had to be covered by the tightened restriction. Does it include cabin crew? The case concerned, sir, I don't know. I haven't checked when was his last time of testing, but the last time he had was March 15, and he was asymptomatic. As for the arrangements for exempt individuals, I'm not that sure about that, but I think all of the measures are intended to prevent imported cases, particularly since there are so many variants overseas. So we are, I think, trying to stop the importation of cases. This one at the back.
Okay, Dr. Chuang, can we first talk about the confirmed case where his family was confirmed last month? Do you think that he actually got the virus at that time, or is it a new infection? The second question is, can you explain why that you think the Lambton case where the woman had been to the restaurant, that you do not think at this stage it's an outbreak at the restaurant now? Can you explain that? And also with the preliminary case regarding the renovation worker at HSBC, did he, could he have actually use the lifts or the common areas with other confirmed cases at the HSBC headquarters? Could they have, how likely was it that they infected each other? Thank you.
I think for the case with family confirmed in February, there are two possibilities. One is that it's a new infection, because he has a recent onset of symptoms of fever, which is compatible with new infection. But his CT value is quite high, so we cannot conclude whether this is a new infection with very low CT and then increasing, or there's a still possibility that the fever this time is unrelated to the infection, but he got an infection while his family were infected in February, and he's just went unnoticed. So we still need to observe for a few more days and see whether he has an antibody after admission, and whether his symptoms or the CT value decrease. So we cannot conclude yet, but we still treat this as a new infection first to proceed with the contact tracing and so on. Your second question is whether there's an outbreak in the restaurant. I think there's for example, if two people go to the restaurant and have meals and both of them get infected, so this is not counted as a restaurant outbreak. It's just a person-to-person transmission. And the neighbor who had met the patient in the restaurant is also, we think, a person-to-person transmission. We have not found other unrelated cases who just went to the restaurant and got infected at the moment. So we do not consider this as an outbreak in the restaurant. And for the preliminary case in the HSBC headquarter building, I think we did not ask specifically, but I think he probably had used the lift, because the stairs, the floors he was working on was on the 8th and the 11th. So I think he probably has used the lift. So it is well known that these common areas may transmit disease. In the same lift or the button or some other common facilities, we don't know. He went there on the 10th to 14th, 10th to 15th of 11th to 15th of March, so it's quite a few days ago. So if anything happened then, probably has been disinfected, because I understand the building has been closed and carry out for disinfection.
Next one. Jingbin.
In the front, please.
Danny Lee, South China Morning Post. Just very quickly, Dr. Chuang, we think it's your 300th physical press conference. So just want to say thank you very much indeed for your contribution over that time. Just on to my questions now. What's the latest on the Ursus cluster? Would you say that the cluster is now under control? And similar to that, there is a media report saying a female executive of an investment firm has gone missing. after she was classified as a close contact of her husband. Do you have any more details about that in particular?
Can
And-
you repeat the question?
Sure. There's a media report that a female executive of an investment firm has gone missing after she was classified as a close contact of her husband, and I'm just wondering whether you have any more details on that. Has anyone from the Woodland Montessori preschool tested positive? And with vaccine slots still being left unfilled, do you maybe think it's a good idea that we could widen the age group even more to ensure those who do want to get a vaccine can take a vaccine for the sake of social responsibility? And just finally, do you have any updates on the case 1989? He's into his 235th consecutive day as listed as critical, so just wanted to get maybe an update on that as well, case 1989. Thank you.
I'm sorry about the second last question about vaccine and testing. Can you repeat again? Sorry.
With slots being left unfilled still, just a handful of slots being left unfilled day by day, do you think it might be a good idea to widen the age group furthermore, just to ensure those who want to get their vaccine can? Thank you.
Okay. For the Ursus cluster, the observation for these 2 days, I mean, we still need to observe for a longer period, but the recent 2 days, all the Ursus cluster cases are found from the quarantine center. So we have not seen any other cases popping up, I mean, claimed to be related or we found to be related, possibly related to the cluster. So hopefully, I mean, this cluster has been controlled, hopefully. So I have not received any report from our colleague that there's some close contact were missing. I mean, if we do, we will know. And also, I do not have details on the vaccine administration details, so I cannot comment on that. And
for the case 1989, I don't have any on-hand information, but the patient is still in critical condition.
下一題，嗰邊白色衫嗰位。
The lady in white, the gentleman in white, TVB. Today we have 10 cases. Dr. Zhuang, do you think that the local pandemic is now under control? And regarding the 62-year-old housewife, normally does she go to meet with her family members or with friends? Are you worried that there might be an outbreak? Normally, how many people would she go for tea or meals together? Yesterday, it was reported that a wife of a confirmed patient has actually tried to, evade, quarantine. Have you heard that? And where does she work? It was reported in the media that the two are actually a couple. Now, even though we now have fewer cases, we only have 10 or so cases, we still have 4 which are of untraceable origin, so the percentage is not low. We're not seeing a lot of cases, of course, and even tomorrow, we also have some cases of untraceable origin. For such cases, as in the case of Ursus, you wouldn't know whether there have been close contacts earlier who are already cases or whether there's any super spreaders amongst them. So we need to be very careful and we need to handle each case carefully to see whether there are any silent, transmission cases. Since we have found so many of these cases, we believe that there are still some cases yet which we have not been able to identify because they have not seen a doctor and so on. So there might still be a possibility of transmission. So I wouldn't say that the pandemic is totally under control, but it is actually in an improvement over the time when we had an outbreak. So regarding the close contact who have disappeared, I don't have any details now, but I can certainly check with my colleagues. I think he went with the husband and the grandchild. So it could be the waiters or waitress in the restaurant, or a few kaifongs who might have come and say hello and have been in contact with them. For the others, they would have been in contact with one or two persons. They could have had meals together. They could be other children, either children or relatives. Over there. Good afternoon. I'm from the Ming Pao Daily. For the 60-year-old housewife who had chats with friends in that restaurant and was not wearing masks, had she been talking to the staff and others in the restaurant? And regarding her family and her grandchild, had they been confirmed to have been infected? And regarding the quarantine for the U.S. consulate staff, have you found any new preliminary confirmed cases? For the couple who works at the U.S. consulate office, other than the daughter who was confirmed, are there other family members of this couple who have been confirmed? Also, yesterday you actually locked down the two buildings in Causeway Bay, the Hoi Tong Court and the Hoi To Court, and two persons so far. So I haven't checked whether or not they were wearing masks. But imagine if you had meals in a restaurant, you would not be wearing a mask unless you are very careful, and when somebody approaches you, you will put on your mask. I believe that the contacts would not have worn facial masks. But even if you put on a facial mask, but if you if you are in close proximity with other people, there is also the possibility of transmission. We've also found in some of the gyms that the people who are infected had actually been wearing masks. Regarding the 62-year-old housewife, one of her family members is now a confirmed case. Regarding the case involving the U.S. consulate office, we have no other new confirmed cases. We haven't seen any new cases yet. Normally, when we collect samples, sometimes the sample could have been missed. I mean, there could be leaking. The sample might have leaked, and sometimes the sample size volume was not big enough. The lady in black. Economic Times. Now, for the untraceable case, the 35-year-old marketing manager was confirmed yesterday. She went to the doctor on the 8th. He was asked to take the test, and she did not go. What is the clinic that she went to? You have a 23-year-old male today. What could you tell us about his itinerary? When was his family members confirmed? Do we have the case number of his family members? You said that you do not rule out the possibility when he was at the quarantine center he was already infected. Why was it that you couldn't find out at the time? Regarding the staff who works in the One Island East, is the company called CLSA Limited. Several people were found to be infected in that building. For those earlier cases, do those people, use the same lift as this new case? And did you take any environmental samples there? And for the two kindergartens where there is an outbreak of upper respiratory tract infection, how many cases are there for each of the kindergartens? What is the symptoms like for the students and the teachers? Would you require them to take the compulsory COVID-19 tests? Regarding the 23-year-old man, I think you can check online the addresses of his family members, but I give you the number. It's 106-871-0743-10530-10560. He had actually been tested, 2 or 3 times, all of which have been found to be negative. I'm not saying that definitely he was already infected at the time, but it is one possibility that at that time he has already been infected, but it was not found out. Sometimes this happens when the CD value is very low. The case could not have been found positive. But it could also be a new infection. Normally, he would have had meals with 1 or 2 colleagues or friends. So nothing unusual. He was not involved in any unusual activities. He might have been in contact with other people. So for the CLSA Limited, I don't know which lift the patient used, but when walking in and out of the premises, there might have been contact in the common area. They might have already have bumped into each other in the common area. So this is an untraceable case. That's why we are requiring the whole building to be subject to compulsory testing. A couple of days ago, we had kindergartens which have been subject to testing because of the upper respiratory tract infections. It might not necessarily be kindergartens. It's difficult to differentiate between whether it's COVID-19 infection or other viral infections. Normally the cases that we receive, for these 2 cases, normally we're talking about 3 or 4 pupils in the same class. Where we didn't have COVID in the past, these would be very, common, infections. We would normally advise pupils who are sick not to go to school and clean themselves. But in the midst of the COVID pandemic, we are worried that there could be a COVID infection, and that's why we require all of them to take the compulsory test so that we can have the confidence that they can go back to school.
The students, probably I don't have the detailed figure. I think it's 3 or 4 students 2-3 days ago. Sorry, speaker's not coming through. Which clinic they went to, I can't recall. I didn't ask. But it was on March 8th that he went to see a doctor for consultation on back pain. So during the consultation, the case mentioned about his other situation, and doctor proposed that you should go for testing. So maybe back then, well, she didn't feel that it's a serious situation. Next one, on the side, please. Hong Kong 01. First question, I want to know, for the variants in Hong Kong, the number of variants in Hong Kong, I want to know, are they from UK, Brazil, South Africa? What is the breakdown? Can you give us a breakdown? And for the 23-year-old male, I want to know about that. What the doctor said it's possible that the male could have been infected at quarantine center. Based on previous cases, is it possible that he had been infected for almost a month before having the onset of disease, and then have the symptoms before being tested positive? And my third question is, there are reports that there's a suspected close contact who work in an American firm who has disappeared or gone hiding. According to the Department of Health usual practice, if there are any close contacts who have gone into hiding, what would the Department of Health do? Would they ask the police to help tracing the close contact if someone has gone hiding? How will this case be dealt with? Well, maybe I didn't make myself clear enough earlier on in regard to the data. 16 VOC, that is a variance of concern. 37 from UK, 8 from South Africa, 5 from Brazil. That is similar to the Brazilian variants. 61 others have not yet been classified. generally speaking, we haven't seen any case, someone having the onset 1 month or 2 months afterwards. So there are two possibilities. One is that, say, if the male during quarantine period he tested positive, then his fever might not be related to the onset. But if his fever is related to the onset, then it may not have anything to do with his the infection history of his family members, because during his family's case he wasn't actually infected, so he could have been infected through other means instead. I personally am not aware of any close contact who's gone into hiding, but I will ask my colleagues again afterwards and see whether they're trying to trace that person or have any difficulties tracing. On the whole, if we are aware of such situations, someone who's gone into hiding, and if we have their ID number or name, first of all, the Kai-Tak Command Center would try to track the person down, and police officers are stationed there too, if necessary. If there's a need for more police support, then of course they will help. Next one, this one here. Yes, Apple Daily. Today, the 23-year-old case who's untraceable and a 62-year-old housewife, in where they live, is there a need to collect environmental samples there from the buildings, and what are the positions that their buildings are facing? And yesterday, the 35-year-old male, he said that he had seen a doctor for his back pain, and there were symptoms. Therefore, the doctor recommended him to go for testing, but he didn't get tested in the end. Is there any mechanism to avoid that from happening so that more patients can really go for testing as required? It seems like doctors can make it compulsory for patients to go for testing, but is there any mechanism to avoid patients not going for testing? Well, in where they live, we'll subject them to the buildings to compulsory testing, but we would not collect environmental samples in every building. We would recommend a deep cleaning first at the premises. And the 35-year-old woman, in relation to their case, is often they only actually could recall the symptoms later on. On March 16, she had shortness of breath, and he went for a test, and test results were negative. When he went back and was asked about her other symptoms, then she recalled that on March 6th, he had problem with lacking smell and taste. And when he went to see the doctor for back pain, I didn't know what really happened during the consultation, but I know that the doctor could ask her, issue notice of compulsory testing to her. If she doesn't follow the order, then that's against the law. But what happened in the conversation, we didn't really investigate that. Last question. Now TV. The HSBC headquarters. The confirmed case now, which floor was it? Were the cases distributed in at the HSBC headquarters? The renovation worker, how was he infected? Do you think is it because of the piping issue or ventilation issues at the headquarters? And which was the previous case of infection which had the onset? And also yesterday, 11346, a untraceable case, and that person went to Chihuahua restaurant in Central. It's also visited by 3 cases related to Ursus Fitness. So are they related to the latest case? And also with the 11360, the housewife, her onset day was March 9th. What were her symptoms? Did she see a doctor? Why did she go for testing so late? The previous HSBC cases, the 2 previous cases, they were related to the Ursus Fitness case cluster, 21 and 22nd floor and 27th floor. So just like the case of another building in Hong Kong East, similar situation there. Even in commercial buildings, Even in residential premises, when we carry out compulsory testing, we would be able to identify other confirmed cases because this disease is so contagious. Unless, for close contacts, people who talk to each other, then they are more easily identifiable. But human-to-human interactions or sharing of common facilities could also result in infection. Any close contacts for cases with a high CT value, even without close contacts, if people, got in contact with others, there's still a chance of transmission. So we can't really guess at this stage whether the infection occur in the lift or what. Whether it's related or not, we need to look at the genome analysis and see how was the cases linked. I forgot your second question, sorry. 11346. She case 11346. I need to check on the details.
Yes. Earlier, we had a few cases where the patients have gone to this Chihuahua place. On the 4th, 1st, and the 6th of March, they are all, customers of Ursus or their close contacts. So for many of them seem to have frequented this place, but we're not seeing a dangerous transmission here. That's why we've asked this restaurant to conduct a thorough cleansing, and all the staff will need to take the compulsory test. For this person, he is aware that there have been confirmed cases in this restaurant. He's been to the restaurant on the 13th of March. So he started to sense that he has lost a sense of smell on the 6th of March. So when he went to the restaurant, it would already have been he would already have been infected. He could have been infected earlier. But since he's been to this place during the infection period, that's why we have notified the restaurant. Preliminary confirmed. The Kaifong has also been preliminarily confirmed. Yes. That's right. Sorry. This bus is not coming through. Yeah, children. Thank you very much.